Let's go ahead and get started with this afternoon's webinar. Just want to say thanks so much to everybody for joining us. This is our second in a weekly series of webinars for dental providers called New Era, New Opportunities, Making Medicaid Work for You. There's a lot of changes in how Medicaid works over the last few years, and we want to talk about that and talk about some of the opportunities to take another look at Medicaid. So let's start, though, this afternoon with just some logistics. We're going to be on together for about 30 minutes this afternoon. We do have a short amount of time, so what we'd like to do is ask everybody to use the Q&A box. You should be able to find that on the bottom of your screen. Use that to ask any questions. Feel free to post questions whenever you like. We'll be able to get to as many as we can, and we'll answer all those after we kind of get through our presentation here. If you do have any technical problems with Zoom or anything else during the webinar, please use the chat to ask for help, and one of our staff will be available to help you out with that. You also, if your problems extend even further, feel free to just email us at info@oralhealthkansas.org, and that will help us. We'll get in touch with you and make sure you get the support you need. So there will be a total of 3.5 dental CEs available for participating in this webinar series. There's 7 weeks and 30 minutes each, so up to 3.5 if you participate in all of those. If you do need CEs, we would ask you to put your name and your email address in chat. If you were here last week, that didn't quite work. We've got that solved. So if you do need CEs, do put your name and email in the chat, and we'll be able to track that for you. I will note certificates will be sent out at the end of the webinar series, so that will be towards the end of September. Another thing to note is the recording and the slides are going to be available on our website. The slides from last week we sent out to all participants already. The recording from last week will be up later this week, as will this week's recording and slides. Those will be all on our website. And it's the pathways-to-oralhealth.org site. With that, I think let's just jump into kind of some introductions to get everybody started this afternoon. So I want to start by just, again, welcoming you to this series and talk a little bit about what Pathways to Oral Health is. This is a collaborative group of organizations working together on 3 kind of key areas in the Medicaid program: providing support for dental professionals to be successful at being Medicaid providers, providing educational programs for both dental professionals and people with disabilities, and sharing some communication tools, especially something called My Dental Care Passport that breaks down some communication barriers and makes it easier for dental offices to feel more comfortable seeing people with disabilities, for people with disabilities to know that that they feel more comfortable as well. So really, it's all about helping to grow the Medicaid dental provider network and get more people better access to dental care. I did say it was a collaborative organization, and so this is the group of all the partners that are involved in this this initiative called Pathways to Oral Health. You can see Oral Health Kansas is a part of it, the Kansas Dental Association, Community Care Network of Kansas. You can see all of the Medicaid managed care organizations are involved, as well as several universities and other organizations as well. We're really grateful to have such a strong bench of partners working with us on this initiative. This specific webinar series is sponsored by both the Kansas Dental Association and Oral Health Kansas. It's also funded by the Department of Health and Environment, which specifically the Division of Healthcare Finance, and through an ARPA grant. Last week, if you were on, Kevin Robertson from the Dental Association was able to be with us and welcome everybody. He's not able to be with us this week, but he will be back next week and would, I'm sure, send his greetings and his gratitude for you all joining us again today. So as just kind of a review, this is what the webinar series looks like. Last week, we talked about new rates and better coverage available. This week, we're going to talk about some different ways that you can manage your practice, manage your patient mix so that you can be a Medicaid provider and still do it on your own terms and make sure it works for your business and for your patients. Next week, we'll actually be joined by representatives from all of the Medicaid managed care organizations, and you can see several other subjects coming up in the next few weeks. Actually, I'm going to launch a quick poll, I think, here, just because I'm curious if you were able to join us last week. So would love it if everybody would want to participate and let us know if you were with us last week. We'd be excited to see that. Just give you a few seconds here. Pretty good participation there. Give another couple seconds. Okay, well, we'll end that and I'll share, looks like about 2/3 of you were with us last week um, for this webinar series, and we're happy that you're back with us again this week. So thank you. Um, I'll next kind of go to what the agenda is for today, and then introduce our speaker for today. Today we're going to talk about who just the Medicaid population is, what it means to be trying to contract with the Medicaid managed care organizations or MCOs, how to manage missed appointments, helping patients with different barriers, and then again share some resources with you. So I failed to begin this whole thing by saying hello. I'm Tanya Dorfberner with Oral Health Kansas. I should have said that at the start, but I'm grateful you're here, and I'm happy to tell you we've got a few of our staff are on the webinar with us as well, and are here to be able to answer questions and provide support. You may see some of the links that you'll see in the presentation. You may see some of those pop in the chat from time to time. Oops, so sorry. And with that, I think I'm going to go ahead and introduce my colleague, Brian Thompson, who's our dental Medicaid facilitator, who's going to take it over and share the presentation with you. Brian, you're muted.
Sorry about that.
There you go.
Thank you for that introduction, Tanya. We want to focus on your ability to practice your way when you participate in Medicaid. Providing dental care for people with Medicaid coverage doesn't mean you have to change your practice. It can help you serve your community while you keep running the practice in a way that works for you. Next slide, please. Who is the Medicaid population? Next. Medicaid covers people who have low income if they are children, including kids in foster care, pregnant women, people with disabilities, and older adults, a population of more than 400,000 Kansans are covered by this program. And all people who have Medicaid coverage have dental coverage. That includes adults. It used to be that dental coverage was limited to children, but it now includes adults. So next slide, please. A dental office can limit Medicaid in a way that makes sense for you. You can choose to serve a certain geography, people in my hometown, people in my county, my region. You can choose to serve people by age. I want to serve just children, or I want to serve just adults. You can choose a population like people with disabilities or older adults. You can limit your number of Medicaid cases to a specific number, 10, 25, 100, or more. You can also choose a specific percentage that you want to serve, 5, 10, 25% or more of your patient mix. One thing you can't do, though, is put limitations on Medicaid patients that you do not put on others. So next slide, please. Contracting with the MCOs. Kansas has 3 MCOs. They are Healthy Blue, Sunflower Health Plan, and United Healthcare Community Plan. The Kansas Department of Health and Environment contracts with these organizations, known as MCOs, to provide Medicaid services. And as Tanya mentioned earlier, next week you'll have a chance to meet the MCOs and learn more about each of them. Next. You decide the limits of your practice. You can choose to contract with 1, 2, or all 3 of the MCOs. What you want to keep in mind is if you don't choose to contract with all 3, you won't be able to serve Medicaid patients from the ones you are not contracting with. So it's going to limit your ability to serve folks. You enroll with KDHE through their KMAP, Kansas Medical Assistance Program website, to be a Medicaid provider. And then after you're enrolled, you work with the MCOs to sign contracts and get credentialed with the ones you choose to work with. Next. Missed appointments. This is a problem for lots of dental offices. Perhaps most or even every dental office deals with missed appointments with all patient populations. It is possible to manage with policies that would apply to all patients. One thing you can't do is charge a fee for a Medicaid patient who cancels or misses an appointment. That's a matter of federal law and policy. So next. There are strategies to mitigate the problem of missed appointments. You can set expectations about why it's important to keep appointments. And you can create a policy that applies to all patients. For example, you might set a 3 strikes policy if someone is late or fails to cancel. After that happens 3 times, for instance, they would go on a waiting list. If there are cancellations or if there's an emergency, then they might be seen, but otherwise they'll be on a waiting list. Next. It's always a good idea to use text and or phone reminders for appointments, including extra reminders on the morning of the appointment. And you can work with the MCOs to use any services they have, which might even include appointment reminders. Next. Helping patients with barriers. Patients who are covered by Medicaid often do have barriers in their lives. Transportation is one of those. Medicaid covers non-emergency medical transportation. That includes dental visits. They can get a ride to your office. And a dental office can work with the MCO and the patient to schedule a ride. You do need to contact the MCO at least 3 days in advance of the appointment to set up a ride. Next. Many people with Medicaid may have gone a long time without dental care. So going to a dental appointment might not be something they're in the habit of doing yet. Providing education about the importance of regular care could help people make the appointments a priority. And you might be interested to know that there is a Medicaid dental code D1330 for oral hygiene instruction. This may help with education about the importance of dental care. So you can provide that education and bill for the time spent doing that. Next. We had a video here that we were going to show, but because of time, we're going to put a link in the chat, and you can go to that video on your own time and look at it. But it explains one dentist's perspective for why he is a Medicaid dental provider. Next. The dental provider network in Medicaid has room to grow. There are a small number of dental providers in the state who are Medicaid providers, only about 1 in 4. And Medicaid, like any other insurance, has improvements being made in coverage and rates that make big changes in how it works. But currently, only about 19% of dentists in Kansas saw 10 or more Medicaid members in 2024. And only 12% saw 10 or more adult Medicaid members last year. So I say again, there is lots of room to grow. Some dentists feel like safety net clinics should provide all the dental care needed for the Medicaid population. That's simply not feasible. Only 3% of the dentists in Kansas operate in safety net or federally qualified health centers. there are, as I said earlier, more than 400,000 people covered by Medicaid. So those numbers are simply not feasible. But there are resources for providers and consumers to help make Medicaid work better for everyone. Next, please. If you provide dental care through Medicaid, you are making a difference. And you can be a successful dental practice, including Medicaid as a payer. With reasonable limits, it's possible to provide care for your neighbors who have Medicaid coverage. Opening your practice to Medicaid helps build relationships and strengthen your community. And we invite you to come back in 2 weeks for another webinar where you'll learn about the Medicaid enrollment process. You can also get started anytime through a link that'll be posted in the chat. Now on to a few resources. The American Dental Association has a Medicaid provider resource all about guidance for reducing missed appointments, which we talked about a little earlier. It includes patient support strategies, scheduling best practices, maximizing practice staff, and demonstrating compassion. On the right, you'll see a portion of that document. That's just a screenshot of a much larger document. Next. Transportation. To help patients schedule a ride, you contact their MCO, and the phone number is on the back of the patient's CanCare ID card. And it can also be more than just scheduling a ride, though. The transportation benefit includes reimbursement for using your own car for a caregiver or someone to provide the transportation. They can be reimbursed for their travel costs. Each of these 3 MCOs has their own toll-free number to call when you need to schedule a ride. And as you'll see, there's a link associated with each one of them where you can find more information about their particular transportation program. Next, please. The Pathways to Oral Health website has a number of dental provider resources. Resources are there to help you choose to become a Medicaid provider. You can also click the Your Practice, Your Way overview. And on the right, you'll see there is a list of provider guidance documents that cover a variety of subjects. Next, please. The Oral Health Kansas webpage also has resources for dental providers. This includes things like an FAQ for frequently asked questions. There's a video from a dentist in Kansas City who does pediatric dentistry and shares why he is a Medicaid dental provider. There's also a lot of information about the adult dental benefits, which are now available just in the past few years through the Medicaid program. And you can find a blog where there are other informational postings about dental care and dental providers and Medicaid and all these subjects. So next, please. I'm here to help. My job is to smooth the water for you as much as I can. So if you have questions or problems, I encourage you to get a hold of me anytime at the email you see there or at the phone number or both. I'll do my very best to help you in any way I can. Next, please.
Actually, Brian, I think that's where we'll stop for the moment. We've got a few resource slides at the end, but I think that's where we'll stop and ask if anybody has questions. We do have a couple of questions in the Q&A, and I appreciate that. I'm also going to note, I'll toss those to you here in a second, Brian, but note that we're keeping track of all the questions folks are asking in these webinars, and we're going to be posting a frequently asked questions document that will have answers to all of these questions. Sometimes we don't know the answer on the day you ask, but we'll do the research and we'll get that answer back out to you. So the first question somebody is asking is if a provider, so somebody says a provider who sees all age groups can elect to see only 0 to 18 years of age care patients, and asking if that's correct.
I believe that is correct. That's what
Mhm.
we've been told, is that you can limit your care population by age, by geographic locale, by percentage, however you want to do it.
And yeah, I think that's exactly right. We would obviously encourage providers to see adults as well. Adults just newly have coverage since 2022. It's not everybody really realizes that yet, but adults have a very nearly comprehensive benefit available. So we really do encourage offices to see adults as well. We think it also helps when when offices see maybe children with disabilities when they grow up. You can keep seeing them because they do have dental coverage now as adults. Another question, Brian, is do the dental claims go to the medical claim address on the back of the cards? Do you know that answer?
I don't know what it says on the back of the card, so I'm afraid to tackle that one at this
Okay.
point. Um, there are a variety of ways to file claims, though. You can file them through KMAP, which is the Kansas Medical Assistance Program, or you can file them through your practice management software. There is something called the Dental Hub, which is a web-based system where you can file through. Some people do that. That's associated with uh, Healthy Blue, and I think it's still associated with United Healthcare, but I'm not certain about that. So there are a variety of ways to file claims, including EDI for batch claims and all sorts of things. And we will get into that in a future webinar. So I would hope you'll come back and tune into that one.
And we will make sure we do address that question directly in that webinar. We'll also put that in our frequently asked questions. We really appreciate questions that we don't even know the answers to, because that helps us get better at learning all this and helping everybody here. We're kind of at a pause on questions, but I wonder if I can ask a question. We shared a lot of strategies around helping people avoid helping offices manage with missed appointments, and I wonder if anybody on the webinar has some strategies you may have tried in your office, and if something has worked well. If you want to post that on chat, we'd love to hear what some of those strategies you've used have been. I think we can all keep learning from each other. So we'll wait for that. While I just kind of wait and see if anybody has any strategies they want to share, I'll move on and share a few last resources as we kind of wind down this afternoon. First of all, next week, actually, we've got two opportunities for you. One is to come back on Tuesday at this same time and watch the webinar about meeting your MCOs and getting to know who they are and how they work. But come back on Thursday next week, and we are partnering with the University of Kansas Medical Center on a 5-session series called Accessible Oral Health. It's all about helping dental offices get more comfortable and build confidence in providing dental care for people with disabilities. It's a 5-week session. If you're not familiar with the Project Echo model, it's kind of a neat model. It's where there's kind of a presentation from an expert on a subject, and then there is a case study, and everybody on the webinar works together and kind of addresses the challenge presented in that case study and gets to kind of brainstorm and problem solve together. So it's a really, really cool interactive way of doing some learning. So come back and check that out. I think we may even be putting something in the chat. I think it is the the last link in the chat is the registration link for that, and that is another free webinar series. Also, would just invite anybody here, if you're not already aware of it, we have Oral Health Kansas has a dental provider advisory group, and this is a group of dental hygienists and dentists from across the state, and includes hygienists and dentists in safety net clinics, in private practices, in all sorts of different settings. Some are Medicaid providers, some are not. And it's just a chance for dental professionals to sit together, talk through some of the challenges they see, ask for support, and honestly offer us support too in terms of how do we provide resources for dental offices. So, for example, a lot of the strategies we shared today around reducing missed appointments came from the brainstorming of this dental provider advisory group. So, oh, good. There's a good suggestion in the chat now. One office tries to have a mix of appointments every day, and then on alternate days are when they see Medicaid patients. So there's lots of different ways of mitigating that. I will just go back to this slide as we get ready to wrap up here, but certainly we've got a couple minutes if anybody has any other questions they want to ask or any other strategies you want to suggest. As we said several times, next week, come back, you'll get to meet the MCOs. Excited to share what they have to share with you. They've got lots of great resources and great people that you get to learn from and meet with next week. Don't see any other questions. I'll turn to you, Brian, or anybody else on the Oral Health Kansas team if you have anything else you want to share before we wrap up this afternoon.
No, I don't believe I have anything. We can give people a couple minutes back into their day.
That sounds great. Well, thanks everybody again for joining us this afternoon. We're grateful for the chance to have you with us, and please do keep reaching out if you've got any questions. And as I said, we'll share the slides and the recording here in the next few days, and we'll look forward to seeing you next Tuesday at 1:15. Thanks, everybody. Have a good day.